Here's a fact that rarely gets discussed. About 1 in 6 men over 40, yes, nearly 16%, are living with chronic prostatitis, often without even realizing it. Some know they have it, but many don't. They keep going about their lives, including regular masturbation, completely unaware that their prostate is silently inflamed. Maybe you've noticed an occasional dull ache in your lower back, a weaker urine stream, or brief discomfort after ejaculation and chalked it up to just getting older. But for men over 50, these subtle warning signs can be easy to ignore until things get worse. In my 15 years as a urologist, I've seen too many men discover their prostatitis only when it starts seriously affecting their lives. Here's the question I hear most from men your age. Does daily masturbation make prostatitis worse? Am I putting my prostate at risk without knowing it? Today, we're tackling this head on, because while 8 out of 10 men with prostatitis will eventually see a doctor, 2 out of 10 never do, often suffering in silence and wondering if their private habits are part of the problem. The reality about masturbation, prostatitis, and your prostate health after 50 might surprise you, and it could change the way you think about your daily routine. Let's get to the science and clear up the confusion. Masturbation, or self-stimulation, is a natural and healthy practice, particularly in later life. From a psychological perspective, it helps men stay connected with their own bodies while reducing stress. During arousal, the body releases hormones that lower anxiety, lift mood, and promote an overall sense of well-being. For many older adults, it can also serve as a way to ease loneliness and counter feelings of depression, offering an intimate connection with oneself without needing a partner. Research in sexology further shows that this habit can boost self-esteem and improve how men view their own sexuality, making it a valuable part of emotional and mental health. For men specifically, self-stimulation plays a role in maintaining healthy blood circulation in the genital area. This improved flow brings oxygen to the tissues, supporting their function and potentially lowering the risk of certain reproductive health issues. Regular stimulation can also help guard against conditions such as erectile dysfunction by keeping sexual tissues active and responsive. Practicing sexual activity in a moderate and mindful way supports sensitivity, preserves function, and contributes to overall satisfaction and well-being. From a medical standpoint, studies suggest that frequent ejaculation may offer protective benefits for the prostate. One analysis found that men over 50 who ejaculated regularly faced a lower risk of developing serious prostate conditions. In this sense, masturbation can serve as a practical way to support prostate health even without a partner, since ejaculation helps clear out built-up prostatic fluid. If that fluid remains stagnant, it can raise the risk of inflammation or infection. Another urology study observed that older men who ejaculated 2 to 3 times per week experienced fewer urinary problems linked to prostate enlargement. This is because ejaculation relieves pressure in the gland and helps expel compounds that tend to accumulate there. It's important not to think of masturbation as a cure for prostate conditions, but rather as one possible part of a broader health routine. Ideally, it should be combined with other habits like eating a balanced diet, maintaining a healthy weight, and practicing exercises that strengthen the pelvic floor, such as Kegels. Of course, there are exceptions. In more serious cases, like advanced prostate cancer or acute inflammation, self-stimulation may not be recommended. When the gland and surrounding tissues are highly sensitive, stimulation can cause discomfort or even pain. That's why consulting a medical specialist is always the best approach, ensuring that sexual activity supports your health rather than interfering with treatment or recovery. It's common for men to feel anxious or worried that masturbation might worsen their condition, and this concern is completely understandable. To address these fears, experts recommend approaching self-stimulation as a form of self-care rather than attaching it to stigma or negative beliefs. Maintaining a balanced mindset and recognizing sexuality as a natural part of overall well-being can foster a healthier relationship with your body and reduce unnecessary stress. In summary, masturbation can be a healthy practice for men over 50, even for those dealing with prostate concerns, provided they're not undergoing treatments where it's specifically discouraged. Practiced in moderation and with awareness, sexual activity can support both mental and physical well-being. It's a way to reconnect with your own body, and in many cases, may contribute positively to prostate health. That said, every situation is different, which is why open conversations with doctors or sexual health professionals are so valuable. Sexuality is an important aspect of life at any age, and taking care of it is part of staying balanced and connected with yourself. Subscribe to the channel, give this video a like, and share in the comments if you learned something new. I read all the comments and will answer your questions.